Hi everyone, thanks for joining. We're going to get started now. Just a reminder, 30 minutes, one question, one follow-up. Today we have Dr. Williams and Dr. Huyer here today, so I'll turn it over to them for some brief remarks.
Okay, well, thank you, and good afternoon, as it's Thursday. So we're looking back over the week of what has gone on and trying to look at what we're dealing with. And so we have a number of things to talk about today. So first of all, how are we doing as far as our data and that is concerned? Since our Monday report, we've reported another 9,190 COVID-19 cases. Another 185 people, unfortunately, have lost their lives in the period since Monday. Our hospitalization's up. We have currently 1,657 in our elevated numbers in the hospital, and the ICU at this moment is at 388. We have been over 400. A couple of days there up to a high of 410 and 411. So that continues to be of great concern to us on the impacts of our healthcare system. You had heard the reports of our modeling, and you can see why the 400 number was noted as being of concern that Dr. Brown had listed. 57% of our cases throughout this time have been reported from our main ones of Toronto, York, and Peel. And if you throw in Windsor, Essex as well, that puts it at 65%. Nevertheless, that's another 35% that have large numbers outside and around Southern Ontario mostly, but we have had some bursts and numbers up in the north as well. So they have not been excluded of having impacts of cases showing and then outbreaks related to various institutions and facilities in the northern jurisdictions. So it's in every region, and so we want to be aware of that. And as always, when we're looking at our data, and we know the framework while being stayed at the moment, we continue to watch that. And we notice that now almost 24 of our health units are in the red zone, of which a good 14 to 16 would be pretty close to being in the gray zone in there. So they have escalated. In fact, we used to have numbers that are over 100,000 that would be in the gray zone. The province at the moment writ large is at 161 per 100,000. So you can see why we're basically province-wide in a gray zone at this time. Health units continue to note ongoing issues related to people's behavior. We continue to have outbreaks in the workplaces, outbreaks still posing in our long-term care facilities. Many of those are staff showing up positive and some residents there, and we have some extensive outbreaks still. And I know our long-term care ministry and staff and the hospitals are working and dealing with those. And with our vaccination program ramping up, we hope to in the workplaces we see behavior that while people know the protocols are in place, some of the people are being lax in that, carpooling together without masking, socializing together either in the workplace or at the lunch hour or outside in various activities without masking, without distancing with their fellow workers. And that has led to, of course, transmission in those sites and those locations. Inconsistent use of PPE, people walking around with a mask, hanging around the bottom of their chin. I still see lots of people walking around with it below their nose. Remember, the nose is one of the main areas where the virus is shed from. So that, of course, makes it fairly well useless if you're walking around doing that all the time. And so households also are gathering, and we've seen some survey information that a large percentage, not dealing with a few, up to sometimes 30-35% of some people are choosing to find reasons to say, well, I think it was okay to get together with one or two other people and 4 or 5 other people, knowing that those 1 or 2 people also got together with another 4 or 5 people. And so I only got together with 2 people, but you actually got together in that mathematics with about 20 or 30 people indirectly. So that doesn't validate that kind of activity. In fact, it adds to our problem and our ongoing transmission in our communities. So social gatherings outside of work and then bringing those infections to work, and people who get infected at work, bring them back, especially into larger homes, especially with multi-generational houses, and infecting 10 or 12 people, 13 people, who then go off to other workplaces and contaminate other workplaces. So this seriousness about staying home and limiting those interactions, being vigilant at any workplace if it's essential to be there, that you do it consistently, do it again and again. And I can't or overemphasize that enough. That's really critically important. At the same time, we really need to be careful with this because we are watching to see the UK variant. You saw reports from the modeling table from Dr. Brown, especially how highly transmittable this organism is, moving much faster and with a very high rate of transmission among people, almost 45% higher than our current strain that we're seeing now. Thus far, we have identified 14 cases. Many of them do have travel history. Some don't have any definite travel history, at least that they can recall, and we continue to investigate that to understand. As a result, we're continually watching for cases. We're continually doing full genomic sequencing, and our laboratory system is developing specific tests that are utilized in identifying the UK variant as soon as possible. But we still have to be vigilant in that, and the UK variant, like the other one, if you're distancing and wearing a mask, if you're quarantining properly, it wouldn't be a problem, and it's not a problem. It's when those things fail, and we've seen that occur, that the transmission begins. As well, I have here that we have been undertaking the vaccine program, and I know if there's some issues, Dr. Huyer can comment on that and his role in the task force. So far, people wondering about the safety of the vaccine. It has proven to be very safe, both in our Ontario situation and internationally, with now millions of doses being given internationally. The so-called adverse events, so far we have had 21 reported in the period since we started December 13th until January 9th, with nearly 114,000 doses given, and all these were deemed to be mild. Allergic reactions, skin reactions, sometimes some muscle pains and aches. None of them had required severe as required hospitalization. So that is the good news on that aspect. The other thing that's happened this past week, of course, to much attention, as of midnight last night, is the stay-at-home order. And this is a step we've taken to further ramp up, turn up the dial, if you may, to try and really get people to do what they need to do. And we've tried in many ways to say that, because simply saying, if you don't fraternize, you don't connect with a lot of people, except your household, if you stay vigilant in that, if you do your distancing, wearing your mask, hand hygiene, staying home if you're ill, getting tested if you need to, and then being even more incubating during incubation period, staying in isolation, if everybody did that, we would be out of this. But people are not doing that. And we're trying to help with people who are either unable, and how can we assist them in that, especially if it relates to isolation facilities, income assistance, etc. We're trying to look at all those different programs to help as much as we can, keeping you informed, keeping you aware, what's going on in your jurisdiction. And then there's the people who are unwilling, and that's why you have to bring in the stay-at-home order. Because some people are unwilling. We've already had some fines before for gatherings in your household, and people have been fined, and you take steps like that. But as the Premier has alluded to, and as the Solicitor General has alluded to, that we are now taking steps to ask our peace officers who have more powers to disperse outside gatherings, to render fines, and to take action accordingly. I'm really hoping that we don't really need to do that. I'd rather people take it seriously, because the staying at home is something you can do, you must do, you should do, and do it again and do it consistently, because over the next number of weeks, numbers down. Getting those numbers down, that means the hospitalizations drop, that means the ICU admissions drop, that means the hospitals open up again, that means elective surgery, and people that are now being postponed too long at times, there are consequences besides COVID. And we got to make sure that that is not part of the problem. So while some people may think it's COVID, it's not a big deal, it is a big deal. And it's a big deal for those people that are being compromised by this in many different ways. And we need to shut this down as soon as we can. So those are the main aspects that I want to speak to today, to bring that up. I can answer a number of aspects related to the distancing. We've said those points again and again, because sometimes people say, we're not sure what we're really asking people to do. I don't know how much clearer we can be that you need to do these things, do them again, and do them consistently, especially over the next number of weeks. And for those that are in certain essential workplaces that need to have some assistance to be able to maintain proper protocol, we have the Ministry of Labor and their inspectors, other people to help and assist in that. We're putting in some testing at different locations. We're doing all sorts of things we can do. We have our community risk identity for people that are in high situations, that have issues with how to make isolation easier, how to deal with loss of income, how we can help you with that. And so we're working with all different components, multifaceted, including our ongoing vaccination program, as we got that window, because In the earlier time, it was like, okay, we got to keep doing and no end in sight. We do have the vaccine program rolling out. That means we stay vigilant until that comes. It's not that far off. It may seem for some people a long time, but it's like with New Year's resolutions, it's saying it's just not the first 10 days and people give up. We got to get even firmer at it, as you would if you had a dietary counselor or a physical fitness guide or kind of saying, nope, stay at it, do more, and keep at it. So we need you to work at that at this time. So this is not going to be easy. I understand that, but we can do it, and we can do it consistently. And in Ontario, we've done it before. And like the Premier, I'm confident that Ontarians can do that and can bring it down. So with that, I'm going to open up for questions from the media. Oh, Dr. Huyer wants to make a few comments as well. So over to Dr. Huyer. Thank you.
Thanks. Sorry, Dr. Williams, for messing that up. Good afternoon, everybody. I think that when I listen to Dr. Williams speak, and I'm sure all of you feel the same way, there's so many key points that he talks about that I really think deserve reiteration and amplification. As I listen to him talk about the number of people in the hospital and the number of people in the ICU, I think about those people, but I also think about the families. I think about the friends who can't attend the hospital because we're in COVID. They can't even be with their sick loved ones very often because of the limitations with COVID. Not only are they sick, but then they're sick on their own. And then, of course, the tragedy of deaths. We've had 62 more reported today. We're past 5,000 deaths, people who have lost their loved ones, and people who have struggled through all of that and probably continue to struggle. And then I think about how we all take the work that we do, and many of us are taking very, very careful steps to ensure that we are isolating, that we are protecting and following all of the steps. There's some that have it very challenging, that aren't able to easily do that, and we're trying to provide supports in the best way possible to allow people to be protected. But I then remember about those who are, as Dr. Williams talked about, the workers who are going out and who are continuing to work while many of us are not in a position where we would be potentially at risk doing our work and potentially getting to our work. And then thinking about those because of our lockdown now and our isolation of those who are by themselves in their homes. And so all of those things come to me as I think about this and as I listen to Dr. Williams, and I really felt they should be amplified for everybody. So I think we'll turn over to questions on that.
Thank you, Dr. Huyer. Over to the questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
First question comes from Chris Herholt at CP24. Please go ahead.
Good afternoon, doctors. Given that we now know of 3 cases of B117 in Ontario with no travel history or known contacts with those who traveled, are we simply counting down to the time before this becomes the dominant strain in the province? And if so, how much time do we have before that is the case?
Well, thank you for answering that. I think it's an important one. That's what we're trying to emphasize with the modeling, and maybe I went over it a bit too quickly in my introductory comments, is that one of the reasons why we're bringing in the stay at home, the more stricter warnings and measures to limit contacts and movement. If you're not contacting, even if you have a UK B117 variant, you're not going to give it to anybody. It takes people contacting with people, and we know with that variant it takes even less contact time. So a face-to-face chat with someone with no mask on, standing 2 feet away from them and laughing and talking for about 4 or 5 minutes, you've transmitted it. And so there's even that more emphasis why we have to be stringent and careful, because with the steps taking place, we can curtail any movement and spread so it would not become dominant. But with the behavior, the wrong behavior, we could follow suit with the way that we've seen, unfortunately, in the UK, with those numbers coming down initially, and then when it took off, it has taken off, and it's having horrendous effects even as they try to carry out their vaccination program. We don't want to go there, and it is preventable if we do what we need to do all the time, every time. So that would be my message, and that's why we have to, as Dr. Brown had alluded to, that's why we mention it, we have to be even more vigilant in doing our personal protective behavior now because of this new strain coming into our midst.
You mentioned some adverse events related to the vaccine administration. Public Health Ontario is saying 21 so far. What type of folks are experiencing that? What range of symptoms are they encountering? Was it the Pfizer, the Moderna vaccine? And what did Health Canada and the manufacturers tell you to expect? Are we having more than what they told you or less?
I'll hand that over to Dr. Huyer to make some comments.
So the initial the initial findings from the clinical trials and from Health Canada was about 1 in 10 would suffer minor effects of sore arm, maybe some general discomfort, feeling unwell, localized discomfort, as I commented upon. The significant adverse effects were very rare, and in this particular case, in ours, 21, they were all not severe. They were adverse effects, but they were not severe, and they were easily managed. Nobody required hospitalization, as I understand things, and that's out of a date period between December 13th and January 9th, and that's out of about 113,000 in injections at that particular point. So this is not anything not in a range that was anything outside of what was expected by the clinical trials.
Next question.
Next question comes from Jack Howan at Queen's Park Briefing. Please go ahead.
Hi, doctors. Dr. Williams, you talked a lot about how Ontarians need to step it up. You talked a lot about the supports the province is giving people, but there are no paid sick days. There's no rent relief in the government's plan. Eviction removals are paused, but eviction hearings are still going. Is this plan going to work without stronger social support measures?
So as I look to, there's an array of support measures, both from the federal level, and they're advocating to the federal level for even some further ones in that regard. There's different methods in there. I know they're looking at around rental and evictions in the aspects to deal with that. So even though we have some things in place, there's more, as our Premier and Minister and Cabinet Ministers are aware of. So we're making sure we try to support those people as they deal with how to maintain the aspects of the ongoing stay-at-home order and how to facilitate that, income support for people who need to cover costs and expenses in there, as well as other components. So there's a wide variation. We want to be sensitive to those and respond to those as best as we can. And people can access information either through the government website for questions and answers, and you'll see it's quite extensive on the different components around the stay-at-home orders. So I advise you to take some time to look at that, look at the various ministries that have those areas of responsibility, and you may want to direct your questions to those ones because they'll have the detailed answers, knowing that there's many unique circumstances. And when you put these directions out, you may want some specific answers to those questions, and they'll prepare to do those if you send them into their specific areas in context of where it's at. So we want to answer those questions. We want to give the assistance and keep working at how to assist you do what you need to do to maintain the stay-at-home order, as well as to prevent any further and reduce the spread of COVID and the UK variant here in Ontario.
Follow up.
On the B117 strain, I was talking to epidemiologist Colin Furness today, who called for stronger provincial measures at Pearson Airport, especially. Though it's federal jurisdiction, he said the province could essentially close the airport by depriving it of road and transit access in or out. Is that something that's been discussed?
Well, you know, the Premier has been very strong, and I have been strong, saying we really have to have very strict measures at our borders, especially at the airport. This has been going on for 4 months. It is a federal jurisdiction. It is their responsibility. You've heard sometimes the federal counterparts saying they feel that they have one of the best protections. We're not in agreement with that. We still find cases coming in. In that, we'd like to have some stricter measures for us to put steps in there. We'd like to do it in partnership with our federal counterparts to make sure we can really tighten that up. In there, we're doing a pilot on testing. We're ramping that up as well, and we're looking at how we might do better testing even at some of our border crossings, that's land crossings, because our input is not only from our airport, but it's also from the many land access points where more numbers are coming in across there, and some people, of course, are going back and forth for various essential purposes, including if they're healthcare workers across in the border states there. So it is a big issue. It's one we're concerned about. We really want to work at that hard and stringently with our federal counterparts because we want to make sure that we can clamp down on that and to stop any further introduction of infections, including the UK and other variants, into the Ontario setting. So that is an ongoing, very much assertive discussion at this time.
Next question.
Next question comes from Laura Stone at the Globe and Mail. Please go ahead.
Hi, doctors. I just wanted to ask you about your colleague Steiny Brown saying today that the government could have enacted stronger policies but chose a different balance. We've heard from Dr. Yaffe saying essentially we need more stringent measures than what the December 26th lockdown was. Obviously, that's what you've done. But I'm curious, Dr. Williams, if you can explain to the public if you recommended anything stronger and what specifically that was that we did not see in what the government announced this week.
So I didn't hear exactly what Dr. Brown said. In that, I know that a lot of the aspects he raised in the modeling we have enacted through the stay-at-home order. From the recommendations, and I think what you have to understand, or I think is important to understand, is our Ontario approach is always keep turning up the dial, if you may. And so it isn't that the stay-at-home order is the first thing we've done. We actually started back in the fall with the framework. And the framework said in different parts of the province, we turn up the dial more and more, whether you're in the green zone, the yellow zone, the orange zone, the red zone, and then the gray zone. And then we went to the modified 2 zone. Then we went to the gray zone lockdown. And then we went to the next step up at the one on Christmas midnight or 26th Boxing Day at 12:01. And we put those things in place. Each time trying to get the public to say, this is what you need to do, because a lot of the behavior and issues are people's personal behavior around their home and their social life, not around their other ones. We kept putting other stipulations in there to say there's 2 ways to go about it. One is that we make you aware, you need to know what you need to do. The other way is there's less reasons to go out and around. So we keep turning back on those things such as retail and social gatherings and different issues there, and trying to do that within the context of what Canadian society usually structures and functions as. Now, having seen that that didn't turn the tide, and people during the holiday season, even with those restrictions on midnight, still continued to socialize. New Year's Eve parties, we had big outbreaks in places that didn't have it before. We're having social events with high-risk people. During that time, we're saying, what were you thinking? Why were you doing that? And it seems that people have some sense or ability to say, logically or irrationally, I just sort of waved it away. I didn't think it would be a big deal. Well, it was a big deal. And so we're putting these other steps in there. The question is that we asked our public health measures table, all the things they recommended, and those ones there that I backed up on that I gave to our minister took forward to the cabinet, etc., were enacted upon. And we're working that now. How well will the stay-at-home order work? How well will people take this seriously? Because their healthcare system, our healthcare system, is at risk here. And you know that our healthcare workers, as you've seen, after this length of time, and now with this onslaught at this time, are getting burned out. And that's a resource we cannot risk. We're trying to get them vaccinated, but the vaccination doesn't decrease the workload, and the workload is intense. And that means not only just doing your nursing job or your medical, your doctor job or respiratory tech, all the different ones that are so critical and important, you're having to do bedside care of people that have no family can come in and see them. This adds an extra stress and emotional tension on them. So we want everybody to understand that and to buy and saying you need to understand this is an Ontario-wide investment, and this is important to you to do there, including our long-term care homes, including our schools that we've had to keep closed in some areas because the community transmission is way too high. Why? Because people are continually not adhering and taking those precautions. And with the UK variant at our doorstep, it can really explode even further, as Dr. Brown noted. So we need that to do that at this time, and we'll have to look at how well Ontarians finally listen to this writ large, not everyone, because some people are doing very well at it. They've been vigilant, and I know that some are getting angry and saying, I'm doing my part, but I watch some other people, and they're not doing it, and they do not understand that. And there's some people that are saying, I'm not doing it, and I don't really care. I really can't understand that kind of thinking. So we really have to get focused on this. We have a task ahead of us. We need to do it and do it well and do it now.
I have to say, just building off Dr. Williams, this is so frustrating. It's so frustrating to be here and hello, Laura, but so frustrating to be here, to be facing the fact that we're locking down everybody's suffering the consequences of, unfortunately, a smaller number of people. Everybody's working the best they can together to take these steps, and unfortunately it hasn't worked because a few or some have not been able to or have not taken the steps that are necessary. And exactly as Dr. Williams pointed out, there's so many consequences that flow from this, and there are steps that can be taken. People took chances, likely. People didn't fully evaluate the risk of the situation that they were going into. People didn't recognize the consequences that could occur from the steps that they took. And it's unfortunately a very tragic outcome in many situations. People have died. People are sick. The healthcare workers are overwhelmed. Hospitals are close to shutting down with with outbreaks in many different settings. There's all kinds of challenges within long-term care homes. I'm sure you can hear the frustration in my voice and the sadness.
Follow up?
Thank you for that. Dr. Williams, you said, you mentioned the term turn up the dial, and you're sort of admonishing people for not listening to the restrictions or the measures that you put in place earlier. But the government faced a lot of criticism for the lockdown date of December 26th. And you say, well, people went out and did shopping. That's because shopping was open. I mean, if things are open, aren't people going to go do them? So can you respond to whether the government should have enacted that lockdown sooner and whether we could have avoided the situation we're in today?
The numbers we saw that were increasing, I mean, the shopping was closed as of the time of the midnight on the 26th. People did shopping before the 26th, but the numbers that we saw later after in the period between Christmas and Boxing Day and into the New Year's were a result of the activities before the 21st. It's that incubation period. We're seeing that. And then after that, we saw some more numbers rising, not because the stores were open in particular. People just started gathering, socializing, going visiting, and doing all sorts of New Year's Eve party stuff, which you're saying, I'm not sure what you were thinking. I mean, how much clearer could we be? But people seem to say, well, there's reasons why I think I can just explain it away. I thought everybody was well. And we know that a lot of people, our high super spreaders especially, will seem like they're healthy and will avow that they have nothing wrong, and yet they're spreading it around in a group gathering. That's why you can't assume just because the people you thought you knew were healthy are not healthy, because while they don't look sick, they can be spreading the virus, and especially the UK variant. And so we can't help but emphasize how careful you have to be. And a lot of that was on people's personal behavior, not because they're at a store here and there in particular, but that was just added to the people's mobility out and around, because you're at the store, you talk to people, you chit-chat, you do all sorts of things because it looks like it's just like things as usual when it isn't things as usual. So it's that overall messaging of one, giving people less reason to go out. That's where you curtail those things. But the key thing is, if you don't need to go out, then don't go out. And we can't be any clearer on that.
Really, the turning of the dial speaks to the fact that there was the respect and recognition that people were working together to try to prevent spreading of this virus. Unfortunately, in all of the different times, with every individual step that was taken with the turning of dial, there wasn't a success. And so further and further steps were taken at the higher, broader level beyond the individual level. And that leads to consequences. That leads to challenges. Those are very tough decisions. And really encouraging and taking broader and bolder and harder steps is a tough thing to do for everybody. And as I said earlier, people suffer the consequences for, unfortunately, the continued spread of this.
Last question.
Last question comes from Melissa Candelaria at Halton News. Please go ahead.
Hi there, Dr. Williams. I just had a quick question in terms of the region of Halton's numbers, if you're able to answer this. Now, Halton wasn't included in the regions that had their online learning extended with the elementary school students, and I just wanted to get a sense just for our citizens as to why that is. What kind of modeling were you seeing that, I guess, allowed the government to not add Halton in that cluster?
Okay, so now you're talking about the schools where it was decided at this time to not open them up on the 25th. As you know, we've asked them to stay in virtual. in southern Ontario until the 25th. At that time, and we've opened up the north, except some medical officers of health have had some concerns about some specific schools and some aspects in the area, and have written orders to keep some closed to in-class attendance at this time. We also said in this time we would be looking at, first it was the decision that the health units that were already in the gray lockdown zone prior to going into the I would say the stain of the framework, namely Peel, York, Toronto, Windsor, Essex, and Hamilton. The decision was to keep those schools into virtual learning situation until the 10th of February, when this current stay-at-home order is in effect up to at this time. It can be extended, but this is where it's in effect at this time. And it was also there that as of the period next week on the 20th, by the 20th, we would look at the framework and see how different health units that were not in those initial 5, are they now in fact in those? And I can say there are a number that would be classified in those categories at this moment, including Halton. Now, can numbers change between now and the 20th? I would like to see them come down considerably between now and the 20th. The Halton numbers yesterday and today were not as bad as they have been. That's encouraging. It's only 2 days. Let's see how it goes. And so we want to look at those numbers before the 20th and to make a decision and to advise Cabinet, because it is a Cabinet decision, of which ones we may want to say, and now some of these other ones may have to go into there. We may find out one of the health units that is in there now saying, wow, their numbers have really come down extensively. Maybe they can come out of it by the 25th. We would have to look at that. I always like to come with the good news because, as I said, our public health measures table was very adamant, if we can in any way, can we get schools open for in-class attendance, especially in the elementary age group? And so that is still very important to us because of the health consequences, the mental health consequences, the learning development in there. At the same time, we have to look at the safety of the students and the safety of the faculty and staff and other ancillary workers in those school settings. When you have community transmission at 20%, we know that just like the waves hitting on the shore, there's going to be piles of people still coming in, and we've seen the positivity rates. So we have to get those numbers down to be convinced to get the schools open. We do want to get them open. We're going to put in more stringent monitoring systems. The minister's already announced some more things in there, as well as masking. So we got to get and back, because we know our schools were safe all fall, and we want that reputation to continue. Because when we open, we don't want to have to close them. And because it's important to have that continued continuity in there for the sake of our young students, especially the younger ones and all the way up. Secondary students can do a lot better with distance learning. Some I know are having real challenges at home with that virtual learning. Not every child is prepared for that. We understand that. I know the minister and the deputy minister have looked at issues around special ed, as well as other children, how to help them in that situation. So we're looking at creative ways to help you, the parents, and the children to work it through at this time, because we're very concerned about that as a consequence of keeping in class held off at this time. And that's another thing. We need those rates down. That gets back to our message again. And I want to emphasize, there's a number of people out there are doing really, have been at it and consistently at it. I know, I've listened to them, and they say, I'm doing my part, but I look down the neighborhood and there's people not doing it. I go out and they're upset too, just like Dr. Huyer's alluding to. And I don't want to not make it clear that a number of people, many, have been very good at this, and I applaud you for that. Keep at it. And yeah, you're going to have to keep reminding your friends and neighbors, saying, need to be careful in this. And so by getting those numbers down around our schools, getting them back down out of the grays into the reds and oranges and that, and down there, that means the transmission gets down low enough. We want those in-class attendances back as soon as we can. If everybody did well and we drop those down precipitously, I'd be more than happy to get everybody back. But I can't do it in the face of huge community transmission at this time. That would be unfair. And parents, 80% surveyed said, we see the numbers. And while I know some are just adamant and writing and emailing saying, open the schools, there's others saying, don't open the schools, don't do it, not at this time. And I'm worried, and if you do, I'm not going to send my child anyway. So our people are divided on this one because people are caught in many situations. So if we can get our numbers down, we can get the schools open, we can deal with this, we can move ahead. And it's so critical. Schools, hospitals, long-term care, a lot of things that we want to do, we want to get back to. While we get vaccination done, We'll get there. The end's in sight. We can move on it. So stay at it. And those that are doing well, fantastic. Keep at it. Stay home. Stay healthy. Stay well. Protect yourselves. Protect others. Protect our schools. Protect our healthcare system and our long-term care facilities. We're in this together. We can do it. I know we can do it. But everybody has to do it.
Follow up, and this is the last question.
Yes, so you did just touch on there. Yes, Halton's numbers have seen some pretty positive downturn. We're doing somewhat well. And I just want to get a sense as to, just through the information you've gotten, the data you have, as to perhaps why Halton's numbers are going on the positive direction, exactly where it's happening, or are we following rules? Is there any specific data that you can share with us as to why it's going in the right direction for us in Halton?
Well, I mean, I would say it's our data as a week ago is still pretty high. These later numbers are looking promising, and I think a lot of people in Halton are saying, okay, let's take this seriously. They maybe have more capacity to do so. It's a different setting in Halton as compared to places like Peel and Hamilton. So there's many things that go into making up, and that's what's so unique when you're dealing with population health issues. It's not as simple as you see it from just one perspective. It's a composite of many things coming together. And each medical officer of health and their staff in their areas, combined with their healthcare professionals, are dealing with the uniqueness of their own settings. And they have different reasons for success, different reasons for frustration, different reasons for perplexity that they're trying to deal with. And I think it's so valuable that the public health areas, they can customize the programs and areas to their specific unique circumstances. That's why some need a lot more attention, like Dr. Lowe is trying to do and like Dr. DeVille is trying to do, to look at those areas of high transmission. What other supports need to be in there? Because they know intimately who are the community leaders, who are the groups that work with these different areas that need to be understood, and we want to work to enable them to do what they need to do, because I think they want to do it. They would like to do it, but there's maybe some things, just a little bit of help here and there that would help them. What's working in Halton may not work in Peel, in certain parts of Peel, may not work in Mississauga, may not work in different parts of Toronto or in Ottawa. That's where we depend on the local medical officer of health and their teams who have been in there with the other social service groups and others to say, what will work best in your area to bring your numbers down? That's why we're going to come up with the framework colors again, because that tells you how you're doing in your respective jurisdiction. You would like to see Halton stay out of gray. You'd like to see Halton come out of red. You'd see Halton go down to orange and yellow. We would like that too. And I know that Dr. Magandhi would like to have that happen as well, and her team. So stay the course, and I'd like to see those Halton numbers staying down. These last couple of days look good. I want them to keep coming down even further and stay consistently down. That'd be fantastic.
Thanks, everyone.